Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to our weekly news conference for the latest in COVID-19 information. We usually do these on Wednesdays, but as you can tell, we're doing it today on Tuesday in recognition of Veterans Day on Wednesday. Let me go ahead and introduce real quick who is on our panel today. We are joined by Amarillo Mayor Ginger Nelson, Casey Stoughton, Public Health Director for the City of Amarillo, Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. What we'll do is we'll let each panel member make a brief statement, and then we will take questions from our media. We will start with Amarillo Mayor Ginger Nelson. Mayor, how are you today?
I am well, Dave. Thank you. I'm here by myself, and I think you can hear me better. At least the microphone on my computer doesn't pick my voice up well if I'm wearing my mask, so I'm going to take it off for just a minute. I want to say thank you. Thank you to our city for those of you who are listening and are engaged and are responding to the need that we have here to better manage COVID-19 in our city for the sake of our hospitals, for the sake of our medical staff, and most importantly, for the sake of the patients who are getting medical care, not just for COVID, but for any medical issue that they're having. We've had community organizations canceling social events, canceling traditional Thanksgiving events. The Thanksgiving prayer breakfast has gone virtual this year, and that is a gigantic tradition, very important for our community, and in their leadership, they have moved that to a virtual event. I've watched other organizations changing their weekly meetings to virtual. Boy Scouts are canceling campouts. People are beginning to be more aware and make difficult decisions to protect our city. Business organizations are also getting involved in these leadership decisions. They're postponing grand openings. They're changing the way they're interfacing with the public, either limiting the hours they're open or preferring curbside delivery, curbside service of their goods and services. And I just want to say to each of you as leaders, thank you. These are not easy decisions, and there's a lot to be weighed. And you, a lot of times as the leader of your organization, are the only one who has all of the facts, both personal, financial, health, all of those facts that go into you making a decision about what to cancel and how long to postpone. Yesterday, there was a doctor's office in our community that emailed all of their patients. And I really appreciated that they put out the facts about what's happening in our hospital, and they put out an ask to patients that said, here's what you can do to help what's happening in our city with the hospitals and the capacity issues that we're having. That's what leadership looks like. So it's not just you choosing individually to wear a mask, which is so important, but everywhere that you have a leadership or an influence opportunity, please be the person who says, let's postpone this. Let's postpone this for just a little while. And of course, we got some very exciting news yesterday about a vaccine on the horizon. So now I feel like we have a light at the end of the tunnel. We don't quite yet have a time frame to attach it to. And maybe our medical experts here will have more information on that. But what I'm telling you, Amarillo, is this is not going to last forever. This will pass. And so please be the leader that can step up and postpone your event, delay your event, meet virtually for a few more months, just to help control the population of sick people going into our hospital. So leaders, thank you for what you're doing. Please don't let up now. We're rounding the corner on the end of this race, and we need to finish strong. So do what it takes, even those hard decisions. I appreciate them. Our hospitals and medical staff appreciate them too. Dave?
Thank you, Mayor. Let's now go to Casey Stoughton, Public Health Director for the City of Amarillo. Casey, how are you?
I'm well, Dave. Thank you. As of today, so our team was able to put our numbers out a little early today for this press conference and our city council meeting later today. So as of today, there were a total of 17,391 total cases of COVID-19 reported in Potter and Randall counties. 9,924 cases in Potter County and 7,467 cases in Randall County. We have a total of 11,435 recoveries, and we're really thrilled about each and every recovery. We are up to 196 deaths reported in Potter and Randall counties, and we're heartbroken at each and every death. That leaves us with 5,760 active cases here in our community. Each of the cases do represent a unique individual. The rolling 7-day positivity average for Potter and Randall counties is at 27%, and the positivity rate at the drive-through testing site is at 49%. The 5-day positive case average for new cases is up to 483 new cases per day. That's a lot of new cases that we're seeing each day. So we're seeing that exponential growth that we've talked about. The Public Health Department's drive-through testing site does remain operational. Individuals can call 378-6300 to be screened and directed to the test site. This week we have tested a record number of patients. Last week our record was 200 new patients, and we have topped that at 212 patients that we saw through the drive-through testing site. I think that's phenomenal, as we have a nurse and a pharmacist working there at the drive-through testing site. So those two healthcare providers are testing over 2 patients a day. And so I really appreciate their hard work and the support staff that's out there. Our drive-through testing site will be closed tomorrow in honor of Veterans Day, but we will be operational again on Thursday. Our community remains at level red. Conditions remain consistent with all of the indicators for level red. And so we will issue a new level red tomorrow that will be in effect for the next 2 weeks. We will consistently be evaluating those indicators, and we'll communicate with you what those indicators are. You can see what those metrics look like at AmarilloAlerts.com. We update those every day at 2:30 when we put out the report card. GA32's hospitalization rate for the 25 county Panhandle RAC region has been over 15% for 23 consecutive days now. Yesterday, the RAC's hospitalization percentage was 30.95%, meaning that right at 31% of all hospitalized patients have COVID-19. I'll let the hospitals talk about their hospitalization information, but the hospitalization rate here in Potter and Randall County is at 6.27%, meaning that 6.27% of the active COVID-19 patients are requiring hospitalization. And you can see again both of those numbers at AmarilloAlerts.com on the dashboard each day. We have children waking up with parents this morning. We have parents waking up without their children, husbands without their wives, wives without their husbands. Our healthcare community is taxed beyond anything that they've ever been stressed before. We have an opportunity to make a difference by wearing our masks, limiting our social interactions, staying home if we're sick or have been exposed to COVID-19. And so please join us in making those life-saving decisions for your family and our community.
Thank you, Casey. Now I go with Dr. Scott Milton, Public Health Authority, Texas State University. Dr. Milton, how are you today?
I'm fine. Thank you, Dave. Just a brief statement. Hospitalizations remain worrisome, and the numbers continue to climb and continue to stress our capacity, especially intensive care capacity. I know that Dr. Weiss and Dr. Lamentier will probably have more to say about this. The vaccine news that came out within the last several days is important. It's a Pfizer vaccine, an mRNA vaccine that seems to be 90% effective. I haven't received any direct communication from potential places where we could get the vaccine. But from just reading through media reports, it looks like it may be available within the next month, which would be wonderful. However, until then, we are still in a dark tunnel, maybe with a little light at the end of the tunnel. And until then, as mentioned previously, we have to comply with wearing masks and avoiding crowds, especially indoors, and protect those that are most vulnerable. So I'll let Dr. Weiss visit a little bit more about the crisis that's occurring.
Thank you, Dr. Milton. Now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you?
Well, Dave, I'm fairly panicked this morning, particularly after talking to my good friend, Dr. Lamentier, who couldn't make the call today, but he updated me on the BSA's numbers. But, and I'll talk about it in a minute. But first, tomorrow is Veterans Day, and that is the day that we set aside to honor Dr. Gonzalez, Mr. Miller, Jordan on the call, and all their military colleagues, past and present, for the incredible personal sacrifice they made to keep this country great. And when I was growing up, I remember hearing my parents and my grandparents talk about, the period during the World Wars where the whole country supported the troops by doing things like victory gardens or food rationing, all for the common good. Make no mistake, we are at war right now. And this war is a little bit different, right? First, none of us can see our enemy, but this 0.1 micron is kicking our butts right now. Second, the battlefield is not somewhere else. It's here. It's our churches, it's our schools, it's our homes. So we're all in the battlefield. But most importantly, right now, we are all combatants. Okay? We're all in this together. But the thing is, that makes us all potential casualties. Okay? And that means our kids, our parents, all of us can succumb to this particular enemy at the present time. I know that there are veterans laying in our hospitals right now that survived combat overseas only to be dying of a virus they caught in their community. That's a tragedy. I think, the minor annoyance of wearing this mask is nothing compared to the suffering and pain and despair that our military folks and their families have dealt with over many wars. Hey, so I guess my point is, it's time for us to return the favor. It's time for us to protect our veterans. It's time for us to protect our families and our loved ones and ourselves by using the weapons that we know work on this thing. And that's the mask right here. That means hand hygiene. It means behaving ourselves in public and keeping distance and not congregating. I'm delighted to hear Mayor Nelson talk about all the decisions, the tough decisions that people are making to be part of this initiative and this cause. We have to do this. There's absolutely, so I am asking all my fellow citizens is, let's keep our veterans safe. Let's keep ourselves safe. Okay, let's commit to the fact that we're going to do what we need to do to see this thing through and come out the other end and hopefully minimize the casualties. The numbers of the hospital are scary. Right now at Northwest, we have 284 patients on the acute side. That's the highest number I've ever seen since being at Northwest. I know BSA has 353 patients in their beds. That's also a record breaker for them. Now, out of our 284 patients, we have 140 patients with COVID-19 right now. That is 28% of our licensed beds. Now, as Casey mentioned, 23 days ago, we were talking about the fact that we might exceed 15% for 7 days. Right now we're at 31% as a community of hospitalizations and 28% at Northwest under licensed beds. That's a doubling of that number in 23 days. We cannot continue that trajectory. No two ways about it. BSA has 187 COVID positive patients. But here's the problem, and Dr. Milton alluded to it. The critical care capacity is the bottleneck. And we've talked about this as being the limiting resource for quite a while now. Right now, we have 68 patients in our ICU, with 48 of those being COVID positive patients. We have no more ICU beds. We had 11 ICU patients sitting in our ED this morning waiting for a bed. I know there's upwards of 14 out in the region right now, critical care patients waiting to try to get to a bed in Amarillo here. We are backed up. BSA is in the same situation. They have 73 patients in the ICU, and they've opened up several other critical care units in their hospital, not traditionally used for critical care. So we're at a breaking point there. Let's make that very clear. We are at a breaking point when it comes to critical care capacity. Thankfully, and we really appreciate the RAC yesterday got both Northwest and BSA some extra vents. So we now have 51 vents instead of 41, but we're using 37 of them this morning. BSA has 52 ventilators. they're using 42 of the ventilators. So we've gained some capacity, but it's not going to go very far if we continue at this rate. Yesterday, we did 357 tests for COVID in our lab. That's the most we've ever done. 20% of those were positive. Again, back, in the summertime, we were talking about 5% positives, 7% positives. Now, every day, we're seeing somewhere between 20 and 35% positives in our testing. We're testing more patients than we ever have. And lastly, our concerns are our staff. We have 109 quarantine staff today. And I know BSA has the same kind of numbers, upwards of 140 plus quarantine staff. So as we gain patients, we're losing staff. Bad combination. That's just not going to work for us very long. Hey, so I guess my appeal is these numbers are very concerning. We're at a point where we're having to make some very tough decisions as a hospital as to how to best triage and take care of these patients in our hospital. In terms of PPE, we're doing very well. Remdesivir, which is the drug that we've been using along with Decadron, a lot of these patients. Currently, I believe we're treating 39 or 40 patients with remdesivir. So we're burning through it pretty quickly, but we do think that has also helped at least reduce some of the mortality we were seeing back in the spring. Because of the capacity, both us and BSA are having to cancel and postpone elective surgeries. At this point, we have to do it. So again, to keep as much capacity for COVID patients as possible. So unfortunately, a lot of patients who need elective joints, who may need bariatric surgery, things like that, unfortunately may have to wait on some of these procedures. The most important thing I think is to realize is I purposely painted a very grim picture because that's where we are right now. However, for those folks who are out there who have experienced chest pain or stroke-like symptoms or other acute ailments, we want to see you. Okay? We have freestanding emergency rooms. We are keeping our surgery floors pristine. Okay? We have the ability to take care of patients who have acute emergencies besides COVID. So please do not delay if you're suffering some kind of medical ailment that you are concerned about. Okay? We will continue to work on increasing our capacity. Okay? But it's also very important that people not be afraid of coming to the hospital. You will not get COVID at the hospital. We separate people very carefully. I know BSA does the same thing. Okay? So it's not a concern. So please seek the attention you need when you need it. But right now, I think for all of us, the more we can do to bend this curve quickly in this community, the better, because at this point, our medical resources have been taxed like I've never seen before. So yeah, that's all I've got for today. Thank you.
Thank you, Dr. Weiss. We'll now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you today?
I'm doing well. Thank you, Dave. So first of all, I do want to echo the sentiments of the panel members prior to me and what we see going on in our community with COVID. We need to take a hard look at what we are doing and how we can ourselves help prevent the spread. We've mentioned the same thing over and over since I've been here in June about social distancing, wearing your mask, not going out if you're ill, decreasing social gatherings that are not necessary. And so we here at our hospital, we have stopped our face-to-face meetings. We have gone to virtual. We have done that to minimize our interaction contact. And so I would ask people to look at those things that they are doing where they're getting groups of people and how can you minimize it. So to echo our COVID numbers, we have 22 currently hospitalized COVID positive patients that we are taking care of. 10 of those are in our ICU. Just to give you an idea, we are a much smaller hospital than Northwest and BSA. Our traditional number of ICU beds is 8. And we have 10 hospitalized in the ICU right now. Why? Because we've had to expand our capability. We've had to do our surge plan. And so typically we only have 27 beds. We are up to 44 right now that we have made operational. So you can do, that's a simple math. 22 COVID, total of 44 beds, that's 50% of the patients that we have beds for. Now, not every bed's filled right now, but 50% of our patients are COVID positive of beds. I do want to just remind our veterans, as Dr. Weiss said, it is important that you seek care if you have other medical ailments. We are not doing elective procedures, same thing. We are doing everything case by case. We are doing mainly urgent and emergent procedures. However, I do want to say that it's important to get medical care. Understand, we do have virtual methods through telephone and through video to see our veterans who may continue to have needs. And so if you have an appointment and you believe we can take care of it virtually, please make sure you give us a call, talk to the team, and we can convert that to a virtual appointment that minimizes the time out in the community and also allows us to continue to take care of your medical needs. As mentioned before, I do want to echo the Veterans Day sentiment here. You know, not just myself, but other panel members, people from the city of Amarillo who make these city briefs take place. And I'm sure some of our media members are all veterans. And so we want to thank you for your service and your continued service in your current roles in making sure our community get the messages they need, such as we are doing right now. Do you want to echo the Marine Corps birthday? So today the Marine Corps celebrates 245 years. And I typically am not one to spread videos, but I'm going to tell you, if you haven't seen it, go to the Commandant of the Marine Corps' birthday message to the troops. It's an 8-minute video. I actually took the time out of our huddle today, and we didn't do our normal huddle. We showed that video because to me, it's a reminder of why we do what we do at the VA. And so, I never was a Marine, but the message was there of what the Marines do for us and our nation. And so I always want to thank our staff for what they do. They are working beyond belief. They are doing amazing things. And just like the other hospitals, we have our staff also out due to COVID or due to exposure. And so everyone else is having to step up and cover even while we surge and expand our capacity. And thank you once again to the city, to the city of Amarillo for this opportunity to speak to my fellow veterans. Thank you.
Thank you, Dr. Gonzalez. Now I'll go to Jared Miller, City Manager. Mr. Miller, how are you today?
I'm good. Thanks, Dave. All right, just want to remind everyone the drive-through testing center remains open, remains busy. We're moving people through there very quick. You're not going to have to wait very long. If you feel sick and you have symptoms you think might be COVID, call the public health hotline at 378-6300 to be screened for the drive-through testing center. If you're referred to the drive-through testing center and you have transportation needs, Amarillo City Transit is providing free transport to the testing center and back. Call Amarillo City Transport Amarillo City Transit at 378-3095, 378-3095 to arrange free transportation to and from your test. I want to remind everyone that we're still under the governor's executive order GA29. GA29 is the executive order referencing face coverings. It requires every person to wear a face covering over the nose and mouth when inside a commercial entity or other building or space open to the public, or when in an outdoor space. Important thing is that, as every single person on here has said, when you're in any of these situations, you need to be wearing your face covering. That is the tool that works, that we know works, has the highest correlation with lower hospitalization rates. That's the way we can drive it down. Also want to remind everyone that we are still operating under the governor's executive order GA32. Primary takeaway from GA32 is, as an area of high hospitalization, all of our businesses in town are limited to 50% occupancy, with the exception of essential businesses and religious facilities and other areas that are available to be open at 100% of their capacity. Still requires every person to observe all components of the governor's executive orders with regard to face coverings, social distancing, sanitizing surfaces, hand washing protocols, etc. I've been asked, why has WRCA not been canceled? When we were going through the period of time right after we became an area of high hospitalization, and Casey talked about the number of days, consecutive days, that we have been an area of high hospitalization. We got to about the latter part of October or the first few days of November when it started accelerating beyond that 15% point pretty quickly. At that point, we decided to make a change with city facilities, including the Civic Center. Now, one of the things that we require people to do when they cancel an event at the Civic Center is provide us 30 days notice. We did the same thing. We provided them the same courtesy and gave 30 days notice, making the intention of being fully closed by the end of November. That is the root cause of why we were doing a phased approach for closing of city facilities to face-to-face interactions. We called every single event that was taking place, scheduled to take place in November, with the intention of reducing the number of events that were going to be held there. A number of events canceled as a result of those conversations. Some did not. We are working with those events to make sure that they can be as safe as they can possibly be. And we have commitments from them, from the organizers, that they're going to observe the governor's orders for face coverings, for social distancing, for sanitation. And we're going to work with them and provide all the necessary supplies and equipment, as well as encouragement. And we're going to require that they do that they follow up with those commitments. So we have those commitments, and we're going to work with them and partner with them to make sure that they're as safe as they can possibly be. That is the reason why we are continuing forward with WRCA. They also have a significant amount invested in time and effort to make this event possible. It would have been a challenge to cancel an event with days' notice. So that is it, in a nutshell, why we are moving forward with some events through the end of November. That's all I have, and I can answer any questions you have. And also I can answer any questions you have on the alternate service delivery plan. If you have any questions about any of the different departments that are affected and how they're providing services to the public and how they are reducing face-to-face interactions. That's all I have, Dave.
Thank you, Jerry. We'll now go to our members of our media who are in attendance. If you have a question for an individual panel member or the panel as a whole, that's completely fine. Let's go ahead and start with David Gay of Amarillo Globe News. David, how are you today?
I'm good. Good morning, everybody. I guess my first question is for Casey. With the Texas Education Agency confirmed yesterday that Amarillo ISD was taking part in a COVID-19 rapid testing project. And I spoke with officials from the district this morning saying that testing staff members has already begun, and student testing will start happening in the next few days. How does that decision the district made, how will that affect, I guess, testing in general for the city?
So we're glad that testing is taking place. I think anytime that there's more testing available, then that's a good thing for our community. It's a good thing for for AISD and for any of the school districts who have that ability. And so we're glad. We're always glad to partner and to make sure, to be partners with any of the groups that do that, to make sure that we get those reports and are able to support them in that way. So that's what we're doing.
Absolutely. And will it take, I guess, any of the quote unquote load off of you guys with them having that additional service provided by the district?
We hope so, but we've seen an increase in demand for testing. And so we're seeing in the hundreds right now. And so we certainly are working with them and are happy to serve our community. And we're glad that they're able to see their students and staff. Right now we haven't seen, I think they started yesterday. And so we haven't seen a decrease in patients. I think there's just an increase in demand right now.
Absolutely. And I guess the last thing that I want to cover on this is, how do you think this addition to Amarillo ISD, how do you think it'll affect overall numbers in general? Do you think that it will affect the numbers in any way here in the area?
So I think that the good thing about the testing is we'll be able to pick up those positives and then get them off of the campuses. And that's what we want to do, is so that there's not a continued spread of the disease. And so that is truly what we want. I don't necessarily think that the numbers are the most important thing. I think the most important thing is that we slow the transmission by people knowing they're positive and knowing that they need to go home and stopping additional exposures. And so while we do see the numbers every day, that's not the most important thing. The most important thing is people knowing their status, knowing that they're positive, and stopping additional exposures. And so I'm thrilled for more testing. I'm thrilled that AISD has that capability, and we're thrilled to support any of our school districts who want to pursue that.
Absolutely. That's all the questions I have. Thanks, Gabe.
Thank you, David. Let's now go to News Channel 10, if I'm not mistaken, Kevin Welch of KFDA. Kevin, how are you today?
I'm good, Dave. See, first of all, I'm not sure who to ask, just one of the doctors. Can you talk about whether the length of stays in hospitals has changed over the course of this pandemic?
Can I say, so when we say length of stay, so in terms of, yes, if you compare before COVID-19 to after COVID-19, Absolutely. We've seen a significant increase in the length of stay, our average length of stay in the hospital. Again, that's all because of the COVID-19 patients. I think Dr. Lamentier and I talked about last week, someone comes in with COVID-19, particularly if they end up in one of the critical care units, you're almost guaranteed they're going to be with you for upwards of 2 weeks to recuperate from that. So, and then we've got patients who are now over 30, over 45 days in the hospital, still trying to recover from the infection. So yes, length of stay has increased significantly because of this virus.
Okay, Casey, it seems like the DSHS dashboard shows Lubbock doing almost double the total amount of tests compared to Potter and Randall combined. Even given the difference in population, why are our testing numbers less?
I would certainly have to look into that. I don't know what they're doing. Some of the other panelists may have different communication, but I can certainly look into it.
Okay, Dr. Milton, what counties are driving the high hospitalization rate in our RAC? Is it?
What county? Well, of course, I'm the health authority for Potter and Randall County, and those numbers are, appalling, and so that's enough right there, I think, to drive the numbers.
I guess the main question is the metro area versus everybody else. Is it concentrated in Amarillo? The high rates? I think that there's general widespread community spread in Potter and Randall County. Just from listening to Dr. Weiss and Dr. Lamentier and kind of walking the halls of the hospitals, there's a continued need to move patients from some of these smaller communities into our big hospitals because they don't have as much critical care capacity now. And of course, now our capacity is being almost overwhelmed. And if we weren't getting resources from the RAC, it would be overwhelmed. So I think if you kind of look at hospitalizations, the numbers that are going up, then generally speaking, I think that most every county is being affected to some degree. And the most important thing to realize is that we just have so much capacity to try to take care of those individuals, and that capacity is being stretched. Thank you. Casey, we don't hear much about the homeless population. Have y'all been encountering them as far as testing and getting positive cases?
So we do have the ability to test. We've partnered with Transit to be able to test people with transportation needs. We also work with community development, Jason Riddlesberger and his team, and then with the hospitals and their teams, we kind of all work together to make sure that needs are met. But we do have occasional positives in every community. And so, but we certainly strive to meet individual needs as they arise.
And I guess also, Casey, who are the people that are driving the demand at the city testing site? What kind of people?
It's just everybody. We have just very widespread transmission at this point, and so we have calls coming in from just everybody who needs testing.
So it's a wide range of demographics?
Yeah,
okay.
It's just, and so we're thrilled to be able to serve everybody in our community, just a wide range of demographics.
Okay, that's it. Thank you, everybody.
Thank you, Kevin. Let's now go to Aaron Langston of KEMR Channel 4. Aaron, how are you?
Pretty good. How are y'all?
Good, good.
First question is, in the past couple of weeks, we have talked about during these meetings, exploring the options of expanding care to facilities outside of the hospitals. At this point, stressed as the hospitals are now, how close are we to having to do that?
Aaron, so in my conversation with Dr. Lamantia this morning, I mean, both hospitals continue to try to expand internally in terms of critical care capacity. But I think we're at this point where we can only wiggle around so much and try to do that. And I think if we continue to see the rise we're seeing, I mean, we have got to start making plans now for what may be a situation just in a matter of days where we just have no more capacity for critical care patients. So I can tell you that there are conversations going on right now as to what is our next move to try to accommodate more patients who need critical care for their well-being.
Okay, and when it comes to that, or if it comes to that, are we in a position with the RAC assistants to have the staffing to expand to those beds?
So the RAC has been incredible in terms of the staff that they have provided. In fact, right now, certainly I can speak to the Northwest. We have more traveling RAC nurses than we have nurses of our own who live in Amarillo working in the hospital right now. I actually brought in some extra physicians this weekend, some extra hospitalists to help with some of the capacity. So the RAC has been just absolutely invaluable in terms of staff and equipment. Certainly, they would be a key part of this next step, this next plan, as to how, if we needed to move to some kind of alternative care site, to have that staffed properly. Absolutely.
Okay. And are we seeing an increase in positives in our nursing homes and assisted living facilities again, or was that kind of a one time and
I think, you know, we see positives just kind of as we move through time, because that is certainly a high risk area. And so just by the nature of living together and that being a congregate setting. And so we do see positives as time moves on. And so we work very closely with those groups. We have a team of staff who are dedicated to just working with the nursing homes. And so I wouldn't say that they're necessarily hotspots or anything, but we do have a team who just work with the nursing homes because they have kind of special needs that need to be addressed. And so we have a team who work with nursing homes. We have a team who work with schools. We have kind of segmented our staff to address the needs of specific groups.
Okay, I think that has me covered. Thank you very much.
Thank you very much, Aaron. Let's now go to David Furtado of KVI Channel 7. David, how are you this morning?
Doing pretty good. And yourself?
Good, thank you.
Good. And I hope everybody is doing well. I know it's been a really rough time here in the city, COVID-wise. So I hope everybody is doing well, all things considered. My first question is going to head over to Jared. I know you mentioned that you guys have been working with folks putting on the rodeo to make sure that everyone is socially distancing and following the governor's orders. But my question is, what steps do we have to ensure we can police that in there? Because I know there, in several locations, even Walmart, we have people not wearing masks, not socially distancing. So what are the ways to be able to police that to make sure that's happening?
It's not an enforcement effort. It's an effort to work with them from a notification standpoint, from an equipping standpoint, from a communication standpoint, so that they can communicate to their people. I don't anticipate we're going to have police officers or anybody else in there trying to give warnings, keep track of who they've given a warning to, then give a citation or anything like that.
So we don't have any foreshore way to make sure people will be wearing masks and things like that. It's more of an honor system.
Well, it's just like anything else. Anywhere else you go, until our area takes serious the challenge, forcing people to wear a mask is going to be a very big challenge. Now, the operators and event organizers do have the opportunity to eject people that refuse to comply. I will tell you that in our experience, we have not had any situations where when we talk to someone, and we will be doing that, that they have refused to comply with the governor's orders. As we educate people, we find that people do comply, especially in the presence of someone saying, hey, I need you to put on your mask. So we have not had any situations where people have blatantly refused to wear a mask in the presence of being told that it's required by the governor's order and we didn't put it on.
Okay. My next question is for Cassie. And now I want to piggyback a little bit off of Channel 10's question about how Potter and Randall County are having less testing numbers than Lubbock. Given those figures or those, I guess, what they found, do you feel that we have the testing capacity to mass test people going into the rodeo to ensure even the asymptomatic patients who can still potentially spread it are not going to be in a large gathering like that?
So we have the testing capacity to test people who need to be tested. So our numbers that have come out today, we've tested the reports to public health. We've tested over 105,000 people, and so those are really strong numbers. And again, that's what has been reported to public health. We know that there's a lot of testing going on out there. And so we appreciate everyone who is testing and everyone who is doing their part. We have not been approached about testing folks at the rodeo, so that has not been an ask of us. But we do have the testing capacity to test where it's appropriate.
Okay, but you don't have say if since the city owns the building, test the people going in to ensure people with positive, possibly with asymptomatic patients are going into that facility?
That's not something that we routinely do. We
Okay.
we do ask that if people are sick, if they're symptomatic, if they have a fever, then they certainly need to stay home.
Okay. And my last question is for any of the doctors on the panel. This is kind of a two-part question. Given the situation that Amarillo is in, being level red, are you worried that this rodeo could perhaps cause an influx of patients? And part B, judging by your professional expertise, do you feel that a rodeo gathering 3,500 people twice a day for the next few days is a good idea to have in Amarillo?
Dave, I would say, so again, we've talked a lot about the masks, the distancing, all those things. The studies that have come out and looked at those particular measures have shown some stunning results in terms of if everyone follows those rules, if everyone wears a mask on an airplane or things like that, the chance of transmission drops precipitously in those situations. Right? So again, I leave it to the city experts and all as to the capacity of a place like the Civic Center. Obviously any congregation of people is concerning, but if everyone does what they need to do, right, the chance of transmission becomes very, very low in those situations. So again, I think that the city's doing the right thing, is working with the operators here and saying that we really need you to do this. And yes, could we have an outbreak? Potentially, but boy, it'd make a big difference if we take those interventions and those precautions. And chances are there would be minimal change in how we're seeing things in the city with that.
Okay. Anybody else like to add it to anything I asked? I'm all out of questions, and I do appreciate your guys' time.
David, thank you very much.
Thank you,
That
guys.
concludes today's COVID-19 news conference. Once again, we usually do these on Wednesdays. We're doing it obviously on Tuesday this week because of Veterans Day.